Hello, Irvin. How are you?
I am good. How are you?
Fine, thank you. And thank you for accepting our invitation. For us, it's an incredible honor to have you here in CPTED Talks.
It's a pleasure to be with you.
Thank you so much. If you may, I will start reading your biography, Irvin, so the audience can know more about your background. And then we start with the interview.
Okay.
Irvin Waller, Professor Irvin Waller is an Emeritus Professor at the University of Ottawa, Canada. He won international recognition for contributing to policy advances on crime prevention and victim rights across the world, including pioneering the UN General Assembly Resolution on Victim Rights in 1985. He served on national commissions in Canada, England, South Africa, and USA, and advised governments in over 50 countries, including most of Latin America. He was a pioneer of the Safer Cities program with UN Habitat, advised UNODC on guidelines on crime victim rights and crime prevention, worked with the Inter-American Development Bank on smart investment for violence reduction, and collaborates with World Health Organization on violence prevention. He's the author of numerous books on crime prevention and victims' rights, which, like his latest Science and Secrets of Ending Violent Crime, are translated into Spanish and other languages. He has an MA Economics and PhD in Law from the University of Cambridge. So thank you for being here, Professor. And the first question is a very basic question. When did you hear about CPTED? Can you tell us the story, please?
So I was a young researcher at the University of Toronto in the late 60s, and there was already some discussion about CPTED at that time. And I was working on a major Ford Foundation grant evaluating prison and parole systems. And basically the conclusion was that prison and parole systems don't stop crime. So I was then looking for what to do for the next piece of research. And I got funding to do a major survey of the public in Toronto about residential burglary. And in developing the questionnaire, we were looking at what victims wanted, but also about various ways of preventing crime. And one of the ways that was being talked about a lot at that time was crime prevention through environmental design. And so I included in the questionnaire some questions about environment, questions about social risk factors in the areas where more of these burglaries were taking place. And I was actually offered a job to work with C. Ray Jeffries in Florida, but decided not to go. But I was very interested in his work at the time.
So you connect with the founder, one of the founder of CPTED, C. Ray Jeffrey. That's great to hear. And as you said, and you comment, CPTED is one part of the equation, but the crime context is very complex. It's a multivariable situation. In that sense, can you explain us a little your opinion about the crime context in a more global scale during this COVID crisis? Because we know that crime context is changing very much and very fast. What is your opinion about that?
Well, first of all, the trends are important. So what seems to be happening universally is that there's an increase in violence against women and presumably an increase in violence against children, both of those. We know that in most countries, property crime has gone down, but this depends a little bit on the COVID measures that have been used. We know that in the United States, gun violence has gone up actually quite dramatically. So when we try and explain these trends, it's very clear that opportunity is important. So if you're a woman confined with a man who is abusive physically, sexually, psychologically, it's going to happen more. And also people who were not necessarily violent or victims before probably became victims during this period. Also, it's highly likely that violence against children significantly increased, particularly confined and not allowed to go to school during COVID. So I think this is very, very important. If we look at the escalation in gun violence in the United States, then I think we see a couple of things. First of all, if you have a lot of guns, you have a lot of gun violence. And if you have young men who are not provided basic financial support, they are going to continue to link up with other young men, trade drugs because it's a way of getting money, and to get into fights around that. Also, COVID restrictions, I think, give everybody a short fuse. So whether it's a man in a household or a young man who's prone to violence anyhow, and you're not doing anything about that, then you're going to get more violence. And the US situation, I think, is really important because it's a very rich country that spends a huge amount of money on reaction to crime, both on police, dramatic amounts on incarceration, close to $100 billion a year on incarceration. And they are not spending anything on trying to tackle either the social causes or the situational causes. They have allowed guns to, if anything, multiply during COVID, the numbers of people buying, and particularly in Black households, which is unusual. So everything was going wrong. And I think if one looks at the high violence countries in Africa, countries like Cape Town or Durban, or you look at cities in Mexico, Los Cabos, or you look at Brazilian cities where governments have only paid for more policing, often not very good policing, and using incarceration, nothing like as badly as the United States, but where they have not been tackling the situations that lead to violence, we are left with these horrendous levels of young men basically killing each other. And in there are a number of nuggets of gold. So first of all, Coahuila in Mexico undertook a study of what seemed to be the causes of violence, both street violence, violence in the home, and people getting killed on the roads, and where they control reductions in all of those types of violence, more than 50%. We can learn a lot from Coahuila. So basically focusing on violence, on alcohol, sorry. We can see the same in Bogota when a leading model of how you reduce violence in the world. And they, one of the actions they focused on was alcohol. One of the other actions was guns, and you saw this very dramatic, dramatic. It took 10 years to reduce violence by 50%, but where most countries just can't imagine reducing violence by 10%, you have these spectacular examples to see an analysis in South Africa, because one of the things they did during COVID was to restrict access to alcohol. So it's going to be very interesting to see whether the criminologists or the public health people can actually demonstrate reductions. There do seem to have been reductions, but of course, if you're talking about domestic violence, it happens behind closed doors. We could measure it through surveys, but we don't. We could measure it through people going to hospitals. And I think in South Africa, they've done that. So it'll be very interesting to see whether that restriction on alcohol had an impact.
Very interesting what you describe, Professor. And I have a question regarding to your description. You mentioned much about audits, surveys. What is the role of the evidence-based approach in crime prevention strategies? Can you describe us, please?
Yes, I can. And I'm pleased to see that for the Kyoto Congress, they are going to mention evidence-based prevention. But evidence-based, for me, and not necessarily for governments, for cities, particularly important because cities can make such a huge difference. I think it means, first of all, looking at what has been proven to work. So we know that outreach to youth, we know that focusing on victims who've been shot in hospital emergency rooms, these have a major impact on repeat offending, and so reducing violence. We know that providing, as has been tested a bit in Chile and in Argentina, reduces violence. We know that early childhood programs reduce violence. We know that rewiring men so that they are not so, they don't use violence so much, and particularly they don't use violence so much against the women in their lives. We know all these things are proven. We also know that better use of public space, designing out crime reduces property crime and to some extent violent crime, but particularly property crime. We know that I've mentioned alcohol. I could mention guns. I could mention focused deterrence programs. I could mention problem-oriented policing. We know that all these things work. So using our knowledge about what works is a very important part of evidence-based. It's more than that. So the Sustainable Development Goals, to which every government in the world has committed, and by the way, a growing number of cities are committed. I don't know of cities in Chile or Argentina, but there are cities in Mexico like Guadalajara, cities like Oakland and Dayton in the United States, like Edmonton in Canada, are committed to a 50% reduction. So if they are going to achieve a 50% reduction, they have to measure outcomes. And outcomes are homicides, are surveys that show you how many women have been raped, surveys that show how many women have been victims of violence in their home, data that comes from hospital emergency rooms. I'm a big fan of data from hospital emergency, reliable than most police data. So you have to measure these, and you have to say, well, in Santiago or in Guadalajara or in Cape Town, we are going to reduce those by 50% by 2030. So you then have to look and begin to analyze the data in your city to see what seem to be the causes, where you can use those proven things or be inspired by them, how you can change what you pay for, because countries have been spending more and more on policing, some of it professional policing, some of it very weak policing, instead of spending it in a much more balanced way where it would make a difference. So it's about measuring what we treasure, we can measure is the very important expression in English. And if we're going to see real reductions, that's what we have. We have to also come up with performance indicators. And these aren't some fancy thing that we ignore. These are things like, do you have an office analyzing using data? Do you actually have a plan that's based on data and based on targets? Are you spending adequate amounts of money? And for me, if you're not spending new money equivalent to 10% of what you're spending on policing in rich countries, and probably the same in low and middle income countries, you're not going to achieve any significant reductions. Are you training people? Are you training people on how to use evidence? Very, very important, on how to plan, on how to raise awareness. These are all absolutely essential elements to success. And these conditions should be very much investing, because there's an incredibly compelling evidence-based case, incredibly compelling. And this is not just, this includes protecting women and children from violence. This includes stopping homicides. And these, for me, are the reason for doing them. And I suspect the reason for most people engaged in actually wanting to see violence reduced. But the compelling case is not just that. The compelling case, particularly in Latin America, in cities in the US, and in Africa, and you can only do this through the evidence-based strategies that I've talked about and investing. You not only protect women and children, you not only save lives, but you also generate GDP. Mexico, conservatively, if it halved its astronomical levels of homicide, it would generate 2 to 3 percentage points in GDP. And that's more than they're likely to do through anything they're trying through economic investment. So investing in prevention is incredibly, incredibly important. And I just listened a day or so ago to the special rapporteur, I think she's called, on violence for the UN. I don't know her title exactly. And she was basically saying, look, when you look at the harm done to children who are victims of violence, and yeah, we can measure, we can financialize that harm. But what you also have to look at is how that harm stops those children from being productive later on and being violent later on. We know about adverse childhood experiences. We have to bring those into the equation. And folk like you and I have to really push this agenda. We know how to reduce violence and property crime, but we also know how to generate growth in GDP that is needed for all sorts of things, not just for jobs, but for reducing poverty, for healthcare, for fighting the climate catastrophe and all those things.
Very relevant what you said, Professor, and I want to highlight the idea of that evidence-based approach is the base of a correct and successful public policies, of safety public policies all around the world. Among all the interesting ideas you present, what is the connection with this design, the design of public policies, with the program that you are supporting or you are involved in the UN, the Safer Cities program? Can you explain us a little?
Yes, so UN Habitat is the UN agency responsible for housing and cities. And in the mid-90s, I worked with actually Franz van der Schuren from Chile. He was working for Habitat at that time, and I was running the International Center for Prevention of Crime affiliated with the UN. And we got together to develop a proposal for Habitat that would be funded by the Netherlands and I forget the other governments that were approached. And basically what we proposed was a program where mayors of cities would establish an office on planning, like I described a few moments ago, that would develop a plan for the city, and the city would then start to invest in the actions. And those actions, the first projects, for instance, there was one in Johannesburg, one in Cape Town, but they spread across Latin America. The idea was that cities would then start investing in evidence-based strategies that were likely to reduce crime. And it was very important in terms of ideas and principles. Like many of these things that have to do with prevention, it didn't get enough funding, and there was always resistance from the status quo. The status quo are basically policing, lawyers, and corrections people. So the programs were good, and now 20 years later, we can see that they were good, and I would say nice, as opposed to effective. And I think one of the most frustrating things for me is to look at the difference between what goes on in the health area, where heart surgeons promote prevention. The COVID pandemic, the people who run ICUs promote prevention. But if you look at policing and incarceration, they don't. And I think the difference is that the people who are working in the health area want to help people. They want to save lives. And they realize that their expensive responses cannot be extended in an unlimited way. And unfortunately, the people, or most of the people in the policing, lawyer, incarceration system have not really understood the importance of saving lives, of protecting women. They think their job is justice. And if you do the crime, you do the time. Well, my whole life, my whole professional life has been built around doing something to reduce the number of victims. And importantly, the surveys, the evidence actually shows that most victims want prevention. Most victims of property want their property protected. CPTED is a good way to do it. Investing in programs to reach youth is a good way to do it. Most victims of violence, contrary to what you see in the newspapers, actually want violence stopped. They want their, many women who are battered don't actually want to be thrown out of their home and moved to a transition house. They want their home to be safe. I who they're living with, who's the father of their kids. They want the violence stopped. And that's just one example. I'm always, I was on the board of the National Organization of Victim Assistance in the United States, where many of those board members were, had experienced very, very nasty crimes. I would go to meetings of parents of murdered children. And what you find is that many of those people are not looking for punishment. They're looking for something to be done about it. You spent some time in Canada. The largest petition in Canada ever was by the mother of a young woman raped and murdered while she was a university student. So, you know, can you think of a more horrible situation?
No.
And her petition was not about more punishment. It was she uses a lot. And she knows that not as much as you and I about what actually works, but she knows that you and I know these things that work. And she wants to see those things happen. And yes, she wants parole boards to be careful about who they release, but she wants more than anything what people call primary and secondary prevention. She knows that tertiary prevention is really too late. Somebody's been murdered, somebody's been raped, somebody's been brutalized. And all the evidence is that we have to get upstream of that. And if we do, we will reduce the number of victims, we will reduce trauma, and we will actually reduce the workload on that reactive prison system.
Yes, you are talking about something so relevant, that is the culture of prevention. Prevention to react before the incident, and this is so relevant for victims, as you said. In that sense, you were our honor guest past year in our International CPTED conference in Cancun. You did an incredible lecture, and all the conference was about crime prevention through environmental design. In that sense, what is the relevance, Professor, of promoting and spreading the word with evidence of prevention? And for that purpose, how is the relevance of ICA, the institution that I lead in a global level?
So you used the phrase culture of prevention. And I think there's nothing more important than increasing the strength of the culture of prevention. And I think that's a question of raising awareness. And there are some affordable ways to raise awareness, and there's some ways that require more extensive support. We live in the social media age, the online age, and COVID has made us even more aware of this. And,
yes.
And this is relatively cheap. The talks with people from the public, with politicians, webinars, all these things are ways of improving that. I would love to see you do a short video, actually 2 parts to it, a 30-second version and a 4-minute version, that you made go viral on social media. Politicians get bored. They play with their cell phones. And something that is fun to watch on their cell phones, so it has to be fun or exciting or both, that will help them understand this incredibly. I actually think that the problem is not the public. I think if you scratch people a little bit, as we say in English, you talk to people, they get prevention. It's obvious. They know prevention from healthcare. They know prevention from climate change. And for most of them, they understand that prevention makes sense. It's the politicians who don't, and they're the ones who have to shift the funding to where it will work. Now, some of these things are expensive. So if you're going to run a government campaign like they've been running on COVID, you have to wear a mask, wash your hands, social distance, and it's all the time on whatever, television. And I think levering governments to do more to raise awareness is really important. Now, that awareness is partly about successes. And some of those successes are things I mentioned. Youth Outreach Cure Violence in the United States has got a lot of attention. Positive Parenting are quite good at promoting their story. Talking about how to help men be less violent is incredibly important, and I think self-evident to many people. But I think we also have to talk about Bogota. I mentioned Coahuila. I could mention Oakland and Boston, but my favorite is actually Glasgow. And Glasgow got a 50% reduction after spending a couple of years doing that plan and diagnosis. And from the point they started implementing the plan, they got a 50% reduction within 3 years. Now, some of those things were limiting access to knives, not guns, because their problem was knives. Some of it was dealing with alcohol. Scotland's famous for overuse of both beer and whiskey. And some of it was tackling the social deterrents. And the fascinating thing about Glasgow is that it is spreading. So the London, England has adopted it about 2 years ago, and they're spending money on that planning group, violence reduction unit, they call it. And they're bringing people from different sectors. You interviewed somebody earlier about the use of CPTED. So some of it is traditional CPTED. Some of it is social equity, investing in areas of poverty where much of this violence is concentrated. And there are now 18 of these. I'm not sure if it's the whole of England and Wales, but most of them. And I think most countries, so low violence countries like Argentina or Chile, can learn a lot from Glasgow. And Canada can too. And I think Canada is, so the city of Edmonton, for instance, has committed to a 50% reduction by 2030. And I think they are now working on what to do about it. And Toronto is a bit slow. It's always a bit complacent, but it is moving now to look at what to do. And I think all of us living in countries that are below the violence threshold of 6 per 100,000 can learn a lot from Glasgow and hopefully from.
Thank you for the information. Of course, we will look in detail the Glasgow experience and take lessons from that experience to apply also in Chile and Argentina and in my region, the South American region. As final message for the audience, do you have a special message to say?
Prevention is the way to save lives. If we get organized to raise awareness and so get politicians to do what is so obvious, they can save lives and they can generate GDP. The numbers of lives are staggering that we could save. A 50% reduction in homicides is 250,000 fewer people dying from violent crime. For women, it's even more staggering. It's 15 million or more women not raped in a year. 15 million. For children, the numbers are difficult to comprehend. The target would be 500 million children who are not victims of violence. WHO estimates they're roughly 1 billion. We know what to do to achieve those targets. And this is using the solid science of violence prevention that's very evidence-based, and it's using certain essentials to make it happen. Having that planning office, doing a plan, putting money in, being inspired by the successes, training people to do it, and engaging the public so that they are aware of how their investment is being used. And we have to measure. What we treasure, we can measure. And the public knows this. And at the moment, we're just not doing it. And that's why we're misspending all over the world and allowing so many people to suffer sexual and intimate partner violence, and so many children, and children goes all the way up to 18 in UN terms, so many children to be victims of violence and not growing up in a world that is safe for them. Let's do it.
Thank you so much, Professor Irvin Waller, for your wisdom, for your experience, all the message you gave here in the name of the International CPTED Association. We appreciate very much your time and always your support for our tasks and strategies. And if you like, this is message for the audience, please subscribe to our channel. So thank you very much, Irvin, and I hope to see you soon.
So thank you for all you're doing.